Hi, my name is Melina Santos and I'm going to be doing my head-to-toe assessment for the fall 2024 adult health class. This is my patient here and now I'm going to scan my room. Have the ceiling, have the walls, have the floor, and have the equipment here. Okay, so beginning my head to toe, I'm going to start with the skin. I'm going to be inspecting the head, the face, the neck, the posterior and anterior chest, and the abdomen. We're going to be looking at the skin's color, texture, temperature, turgor, moisture, and edema. Also looking for scars, bruising, lesions, and nevi. Then I'm going to move on to the head. I'm going to be looking at the hair color, texture, and distribution, as well as looking for any infestations. And then I'm going to begin by palpating, feeling for any tenderness, any depressions, any lesions, or any abnormalities in the scalp. And then we're going to be moving on to the lymph nodes. We're going to begin with preauricular lymph node, postauricular lymph node, occipital lymph nodes, tonsillar lymph nodes, submandibular lymph nodes, submental lymph nodes, anterior cervical lymph node, posterior cervical lymph nodes, supraclavicular lymph nodes. Okay, nothing there. And then we're going to be assessing TMJ. The TMJ, so can you open and close your mouth? Okay, so no crepitus or subluxation, any tenderness with that? Okay, good. Now we're going to be doing cranial nerve number 5, the sensory portion of it. So close your eyes and let me know when you can feel where you're feeling me touch you.
Forehead, left cheek, right cheek, chin, nose.
Okay, perfect. And now the motor portion of cranial nerve number 5, trigeminal. Can you bite down? Okay, perfect, nice and strong. Now we're going to be doing cranial nerve number 7, facial. So can you lift your eyebrows up for me? Can you puff your cheeks out? Can you pucker your lips? Can you frown? Okay, perfect. And then we're going to be moving on to the ears. We're going to start with looking at the shape and position of the ears, looking at or palpating the pinna and the tragus for any tenderness. Any tenderness with that?
No.
And then we're going to be using the otoscope and looking at the ear canal and the tympanic membrane, making sure it's intact, pearly gray. And again on this side, intact and pearly gray. And then we're gonna assess the eye movement. We're gonna be doing the cranial nerves number 3, ocular motor, cranial nerve number 4, trochlear, and number 6, abducens. So we're going to be testing the 6 gaze of feel and looking for accommodation and convergence. So follow my gaze, follow my pen with your gaze. Okay, perfect. And now we're going to do cranial nerve number 2, optic with pupillary reaction to light, and then with the Snellen chart. So look at me right here. Okay, perfect. Pupils are equal and reactive to light. And now we're going to use the Snellen chart. Can you read me the lowest line, please?
LTFPH.
Okay, perfect. Now we're going to do peripheral vision. So cover one eye for me. How many fingers am I holding up?
2.
Now the other side.
3, 2.
Okay, perfect. Now we're going to be palpating the temporal arteries for any tenderness. Any tenderness with that?
No.
Okay, perfect. And And then using the ophthalmoscope, I'm going to be looking at the internal eye structures and then testing for the red light reflex as well. I'm going to flip this up. Okay. Okay. Perfect. Put your glasses back on. Now we're going to be testing cranial nerve number 8, vestibulocochlear. We're going to be doing the whisper test, the Rhine test, and the Weber test. So starting with the whisper test, let me know what I'm saying to you.
A, B, C.
Okay, and now on the left side.
1, 2, 3.
Okay, perfect. Now we're going to be doing Weber test for lateralization, so let me know which side you can hear this on or if it's equal in both.
Equal.
Perfect. Now we're going to be doing air and bone conduction, so let me know when you stop hearing this, okay?
Can't hear it. Can't hear it.
Okay, perfect. And now on the other side.
Can't hear it. Can't hear it.
Okay, so air conduction was greater than bone conduction. Now we're going to be doing the nose. We're going to be making sure it's midline and straight and checking for nasal patency and cranial nerve number 1 olfactory at the same time. So I'm going to plug one nose and then let me know what you smell.
Fruity lotion.
Okay, and what about this side?
Fruity lotion.
Okay, and was it equal on both sides?
Yeah.
Okay, perfect. Now we're going to be moving on to the mouth. I'm going to be looking at the lips, the teeth. Can you open up for me? The gums. Go ah. You're going to be looking at the tongue, the salivary ducts. Lift your tongue up. Underneath the tongue, the buccal mucosa, the soft palate, the tonsils. Okay, now stick your tongue out and say ah. Okay, perfect. So by doing that, I could see cranial nerves number 9 and 10, glossopharyngeal and vagus, the uvula and soft palate rose and fell with phonation. And as he was sticking his tongue out, I was assessing cranial nerve number 12, hypoglossal. The tongue was midline without any fasciculations. And now we're gonna be assessing the neck here. We're going to be looking at the trachea, making sure it's midline, and palpating for the thyroid gland. Nothing was enlarged there. And then we're going to be feeling for the carotid pulses, both sides. And we're going to be auscultating for bruits. Perfect. Now we're going to have you turn around and I'm going to assess your posterior chest. Thank you. So we're going to be assessing for any respiratory distress, looking for tripod positioning, looking for cyanosis of the skin, any retractions, or use of accessory muscles, nasal flaring, tachypnea, none of that. So now I'm going to be looking at his back, looking for symmetry or any obvious deformities. And then we're going to check equal chest expansion. So can you take a big breath in and out? Perfect. Now we're going to do tactile affirmatives. I'm going to have you say the words 99 every time I move my hands.
99, 99, 99, 99.
Okay, perfect. And now we're going to be percussing in between the intercostal spaces. Perfect. And now we're going to be listening to the posterior lobes. So take big deep breaths in and out for me. Okay, perfect. Now we're going to be assessing egophony. So I'm going to have you say the word E every time I move my stethoscope.
E, 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 E.
Okay, perfect. Now we're going to be doing bronchophony. So can you say the word 99 every time I move my stethoscope?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. And now we're going to be doing whisper pectoraliquy. So I'm going to have you whisper the word 99 every time I move my stethoscope. Okay, perfect. And lastly, while I have him here facing on his back, I'm going to be checking for CVA tenderness. So here at the 12th rib, or underneath the 12th rib. Is any of that tender?
No.
Okay, perfect. I'm going to have you turn around. And we're going to finish the respiratory assessment from the anterior chest. So I'm going to do the tactile firmness again. So have you say the word 99 every time.
99, 99, 99.
Perfect. And then equal chest expansion. Take a big breath in. Okay, perfect. You can cough if you need to. And then I'm going to be listening to your lungs. Big breath. Okay, perfect. Now we're going to be moving on to the cardiac portion. So I'm going to listen to all 5 cardiac points with the bell and diaphragm of my stethoscope. So we're going to start with the aortic valve, the pulmonic valve, Erb's point, tricuspid, and mitral. Now all 5 points again: aortic, pulmonic, Erb's, tricuspid, and mitral. And now we're going to be filling here at the PMI. Okay, and now I'm going to be listening at the apical pulse to assess rate and rhythm for a full minute. The rate is regular, the rhythm is regular, and the rate is about 60 beats a minute. Okay, now we're going to have you lay down at 45 degrees. We're going to be assessing for any jugular vein distension and any heaves or lifts. And then I'm going to be assessing for any thrills at all 5 cardiac points. And now I'm going to be listening to all 5 cardiac points again. Okay, perfect. Now I'm going to have you lay flat and I'm going to assess your abdomen. Do you need to scoot down?
No.
Okay, so I'm looking for any symmetry and any abnormal contours in the belly. I'm going to begin by assessing the major arteries. So the aorta and the iliac arteries, or renal arteries. iliac arteries and femoral arteries. Okay, no bruise heard there. Now I'm going to be listening for bowel sounds in all 4 quadrants. Okay. And now we're going to be percussing all 4 quadrants for tympany, dullness, or flatness. And now we're going to be palpating all 4 quadrants. Feeling for any masses or tenderness. And then we're going to be palpating for the liver and the spleen. Perfect, and the spleen was not palpable. So I'm going to have you sit up. Now we're going to move on to the musculoskeletal part of the assessment. We're going to begin by assessing the joints in the fingers, the wrists, the elbows, and the shoulders, looking for symmetry, looking for redness, tenderness, swelling, crepitus, nodules, anything like that. So can I have you put your hands out? Don't feel anything. They're all symmetric. I'm going to feel the radial pulse and assess capillary refill. Looks good. Can you squeeze my hands for me? Okay, 5 out of 5 grip strength there. And now we're going to be doing range of motion. Okay, so follow me. We're going to abduct and then adduct your fingers, and then flex, extend, and hyperextend. And we're going to do thumb opposition. Perfect. And now the wrist, you're going to flex them down, extend, and hyperextend. And then you're going to ulnar deviate and radial deviate, and then you're going to circumduct them. Perfect. And now with your elbows, you're going to flex them in, extend them, and hyperextend if you can. Perfect. Now pull them up again. Pull me towards you. Now push me away. Okay. So 5 out of 5 strength in the biceps. Now we're going to be doing your shoulders. So you're going to flex forward and extend and hyperextend back if you can. Then we're going to do internal and external rotation. Perfect. Making sure your fingers can touch. And now on the other side. Okay, perfect. Now you're going to abduct, and then you're going to push your hands up against mine, and now down. Okay, so shoulder griddle, 5 out of 5 strength there. And then we're going to have you circumduct. Perfect, and now abduct. Pull them down together. Okay, perfect. Now we're going to be assessing cranial nerve number 11, spinal accessory. Can you shrug your shoulders for me? Okay, perfect. So that's all intact. And then while I have you sitting here, I'm going to be doing deep tendon reflexes. So brachioradialis, and then the biceps, and the triceps, okay, patellar, and then the Achilles, and the Babinski. Okay, perfect. Now we're going to be assessing the joints of the hips, the knees, the ankles, and the toes. Again, looking for symmetry, nodules, anything like that. Redness, tenderness. I'm going to be feeling the dorsal pedis pulse and the post-tibial pulse. And assess the capillary refill in the toes. And then we're gonna do the strength in the feet. So push down on my hands. So plantar flexion and dorsiflexion, pull out. Perfect, 5 out of 5 strength there. Now we're gonna do range of motion in the toes. Can you abduct and then adduct, flex them down, extend and hyperextend. And then with your ankles, we're going to plantar flex, yep, which is down, dorsiflex, which is up, and then we're gonna invert and then exvert, perfect. And then can you circumduct your joint? Okay, perfect. Now we're gonna push yep, against my hand, and I'll pull in towards you. Okay, 5 out of 5 is straight there, and then with the hips, push in against the hands and push out. Okay, 5 out of 5 straight there. We're also going to be assessing for soft touch in the extremities. So close your eyes for me, let me know where I'm touching you.
Right arm, left arm, right leg, left leg.
Okay, perfect. Now we're going to have you stand up and we're going to assess the range of motion in the knees and the hips. So turn maybe this way. Okay, so flex your knee up and extend it, and then, flex it and then extend and hyperextend. So push back as far as you can go. Straight, kick back, okay. And now with the other two, kick forward. Just kick forward, and then extend and hyperextend back as far as you can go. Okay, perfect. And now the hips, we're gonna have you flex your knee up, and then we're gonna have you go across, and then back out. There, so we're doing the internal and external rotation there. Can you do the same with the left side? Okay, perfect. Now we're gonna have you flex your leg forward, and then kick it back. Okay, sorry. And now kick it to the right, so abduct and circumduct. And now to the other side. Yep. Just kick out and the circumduct. Okay, perfect. Now we're gonna assess this lumbar spine. So I'm gonna have you bend forward. I'm gonna be looking at the curvature and alignment of the spine, checking for any scoliosis. So come up nice and slow. Okay, perfect. And now we're gonna do lateral flexion. So can you bend to your right and now to the left? And then we're gonna rotate. Perfect, and now the other way. Okay, and now we're gonna do the same with your cervical spine. So flex forward, look down, and then extend up and hyperextend back. And then we're gonna laterally rotate, so look to your right and now to the left, and then circumduct your neck, twist it around. There you go. Any tenderness with any of that? Okay, so I'm gonna have you walk forward regularly. And now walk back heel toe, tandem. Perfect. And now stand right here and hop on one foot. Okay, perfect. Now we're gonna sit you down here. And we're gonna do a couple more tests. We're gonna test for vibratory sensation. So medial malleolus, let me know if you can feel this.
Yes. Yes.
Okay, and then ulnar.
Yes.
Ulnar prominence.
Yes.
Okay, perfect. And now we're gonna be doing graphesthesia stereogenesis. So close your eyes for me. Tell me what I placed in your palm.
A coin. A paper clip.
Okay, perfect. Now let me know what I write in your palm.
J.
Okay.
A 7.
Okay, perfect. And now we're gonna be doing cerebellar coordination. So can you tap your finger to your thumb as fast as you can? Okay, we're gonna do the hand flip flop. So put it on your hand and flip it back and forth as fast as you can. Okay, perfect. Now I'm gonna have you touch your finger to your nose and then to my finger as it's moving. Okay, perfect. And I think that concludes my head to toe assessment. Thank you.